Hello, everybody. My name is Dr. Monica Maloof, and I am one of the co-presidents of Physicians for a National Health Plan in Illinois. And I'm really excited to have the opportunity to talk to you all about a little bit about what I do and why I do it. To give you some background on myself, I am a general internist. I practice general internal medicine at Loyola University outside of Chicago. And I spend most of my time doing primary care, patient care, and doing education to our medical students and residents. But then outside of that, I also participate in a lot of advocacy work. And one of my biggest advocacy roles is working with the Physicians for a National Health Plan, PNHP, and the Illinois Single Payer Coalition to advocate for Medicare for All on the community level, the regional level, the state level, and the national level. So I'm excited to be talking to you all today. I've led a few workshops for my residents and students about physician advocacy, and I always like to start off by telling you guys a story. So I'm going to share a story with you, and I want you to reflect as I'm telling the story on what the story means to you. So once upon a time, there was a town that was built just beyond the bend of a large river. One day, some of the children were playing by the town, and all of a sudden they noticed bodies floating in the river. And they ran out to the town and grabbed the townspeople and asked for help, and they brought people over, and they found that there was 3 bodies in total. The townspeople pulled the bodies out of the water, and they found that one body was from an individual who had died, so they buried it. One of the bodies was a living person. So they took that person to the hospital to get treated, the local hospital. And the third person was a healthy child with just a few injuries. So they took that child to someone's home, to a foster family, to care for that child. From that day on, every day, more and more bodies kept floating down this river. And every day, the good people of the town would go down to the river, look for bodies, find whoever was floating in the river, pull them out, and care for them. They would send the sick to the hospital where they got treatment if they needed it. They would place the children or injured people with families and foster homes to take care of them if they needed that. And anyone who had passed away, they would bury them in their local cemetery. This went on for a long time, for so many years that the town just ultimately came to expect bodies floating in the river, and they built elaborate systems and infrastructures for dealing with this new issue that had arisen in their town. They built systems for taking the bodies out of the river. They built protocols and platforms for dealing with the injured and the ill that came into their town. Many of the townspeople were very generous, donated time, energy, and money to this task. And the town itself grew to feel a sense of pride in its generosity for caring for these individuals who came floating down the river. However, during all those years, despite all their generosity and efforts, nobody in the town ever thought to go up the river to ask the question of why every day these bodies came floating down the river. So I want you to take a minute and think about what that story means to you. I'm going to pause here. For me, this story is an allegory of what I see every day in my practice. I see systems that are run by compassionate and caring people, but systems that are failing to ask the questions of how we can build and prevent downstream bad consequences. So I see around me wonderful doctors, wonderful nurses, and social workers and therapists, and people working really hard. But ultimately, we're not asking the questions of upstream. How can we prevent the downstream consequences that are plaguing our healthcare system? What I mean by that is that every day in my practice, patients are coming to me and asking questions about finance, being able to afford their medical care, being able to afford treatment. They're asking me questions about, switching insurances and being afraid that they're going to lose their cancer doctor. They're asking me questions about when they can retire because they're so worried about not having health insurance when they retire. And every day it makes me think about what we could be doing to build a more healthy and equitable healthcare system, how we can fix the upstream problem so that downstream our patients don't have to be suffering and dealing with the inequities that are built into the system as it exists today. So after being witness to so many of these issues for so long, I decided that part of my career necessarily had to be working in advocacy to help fix some of these problems in our healthcare system. And that's why I chose to work with PNHP. There's a million ways to be a physician advocate and a million causes to advocate for, because there's so much wrong with our healthcare system when we look upstream. But for me, PNHP has been an excellent platform to advocate, like I said, on the policy level, and to collaborate with some amazing people at the state and regional level to fix the issues, some of the issues plaguing our healthcare system. Some people may ask, like, what our duty is, like, what's our duty as a doctor to participate in advocacy work? I think that that is a really important question because we all are working so hard as it is. And physician burnout, as we all know, is an epidemic that is plaguing our generation of physicians, and demands are high, our time is limited, and we can often feel really overstretched. I think for me, I find it necessary to find the time to do advocacy work, but I also tell everybody to give themselves grace and kindness. If you don't have the time or the energy, that is okay. But if you do, think about the things that make your voice so unique. We have a unique window into people's lives as physicians. We are witnesses to the intersection of institutional injustices on health, on the family, and the legal system, unlike anybody else in society. We also get to meet and talk to patients across socioeconomic and racial groups, unlike, which is a very rare privilege in society. There's very few jobs where you meet people from such diverse walks of life on a daily basis and get to talk to them about such intimate aspects of their lives. And in addition to that, public trust in physicians is very high. Whenever they do these surveys on, which professions are most trusted and respected, physicians are always, in the top 2 or 3 or 4. And people trust and value our insight and our opinions. So when we engage in advocacy work, when we make public statements, people pay attention and they listen. Beyond that, our professional charters have some statements embedded in them about advocacy and community well-being. The American Medical Association, the AMA, says in their Charter on Medical Professionalism that physicians must, quote, advocate for the social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. So it's something that we are called to do, that we are in a unique role to play. And I think that that's good to keep in mind. So what do I do exactly? What do I do for PNHP? So I started off by just being a member of our local chapter. I joined and I got to meet amazing physicians from across Illinois, from across the city of Chicago, who are doing great advocacy work, not just for Medicare for All, but I love our group because everybody has their own side projects, their own side passions on top of that they're working on. Whether that's working to create access to healthcare resources, vaccine equity when it comes to COVID, to people doing local community outreach to at-risk communities. One of our leaders works passionately with the disabled community locally. So I got to meet this amazing network of physicians who I got to collaborate with on a few different projects. And then from there, partner with them and with others in our state, including nurses and social workers and pharmacists, to talk about single payer healthcare and raise awareness. So a lot of what I do is go to speaking events, spoken at local community forums. I've spoken at political town halls, and I've spoken at local educational institutions. So at an undergraduate university to a pre-med group, I've spoken at medical schools to medical students, and I've spoken to residents and physicians in different hospitals. And the large goal of that is to help raise awareness and educate people about some of the inequities and why I think Medicare for All is the answer to some of those inequities. One of our big local victories was we, along with a few other members of the Illinois Single Payer Coalition, we hosted a few events with local Illinois Representative Marie Newman, who was a progressive running to replace Dan Lipinski, who was a very conservative Democrat in Illinois, and he was historically staunchly opposed to Medicare for All. Marie Newman ran on a platform that was more progressive and supportive of Medicare for All, amongst other progressive policies that she was an advocate for. So we partnered with her. We spoke at a few of her town halls that she hosted regionally, and she was actually elected to the House this year to replace Dan Lipinski, which was, I think, a big success for the movement. So that's one of our local victories that I think, in partnership with everybody who participated in that work, we can claim as a success, because the more advocates and allies we have in Congress, the more likely that we are to succeed in pushing forward single payer legislation. Some of our other local victories, I would say, include creating a robust network. So the Illinois Single Payer Coalition is just a coalition separate from PNHP, but it's been amazing because we do a lot of partnership work with them. And as I might have mentioned earlier, it's a collaboration with nurses, social workers, pharmacists, people from across the healthcare spectrum, getting together in the state to advance this conversation. So PNHP is Physicians for a National Health Plan, but it's important to realize that we're not the only people in this fight, and we are going to need a broad coalition to help push forward these changes in policy. Some of my tips for people that I give, tips for success as a local community advocate or a policy advocate, is to, one, make sure you're comfortable with public speaking, because once you become a local expert, people are going to want to hear from you. And sometimes it's hard to think of yourself as an expert. I didn't go to medical school to be an expert in healthcare policy. But as my friends remind me, I read more about it and think more about it than most people in society. And I stay up to date on a lot of the literature just because it's something I'm interested in. So by default, it helps me mean that by definition, I'm more of an expert than most people. So people want to hear my opinions and thoughts on it. And so getting comfortable with public speaking has been really important for me. So if you're interested in getting involved in that respect, I think that thinking about ways to build up your public speaking skills can be really helpful, so that when people ask you to participate in podcasts or town halls or speaking forums, you feel excited to jump on board and not nervous. The other success I've had is really just being an ally and a partner. So I do not shy away from meeting with, like I said, people from other specialties, from other fields, business leaders, legal experts, as I mentioned earlier, other members of the Illinois Single Payer Coalition. So just building a broad network of people and allies and advocates, and not shying away from meetings if they're somewhat outside of my realm. So if I'm meeting with people who are outside of medicine. My last sort of tip for success is to think about the voice that you want to put out there and to remind yourself the power of that voice. So some of you may have seen me or read some of my tweets that I post on Twitter. So part of what I do on Twitter is think about the message I want to be putting out there as a doctor and as an advocate. So I tweet a lot about Medicare for All. And it's a constant balance between staying professional, maintaining a professional persona as a physician, but also advocating for something that I'm passionate about and that I dedicate a lot of my time and energy to. So what I've learned from that experience is that putting myself out there, having a social media platform where I can express my advocacy beliefs and my moral objections to the corrupt system as it exists, has been a really powerful tool. With power comes responsibility, so tweet responsibly. But it's been a great way to meet, again, people from broad parts of society that I may have not had a chance to meet otherwise, and to help get the word out there and to help start conversations. So as a rule, I don't have long conversations on Twitter, but if people ever want to have a conversation with me, I will share with them my email. I will invite them to have a phone conversation so that we can advance this conversation about Medicare for All. Those are just some small tips that I have. but I'm sure that there's 100 other unique approaches for being a physician advocate. I just want to end by encouraging you all to consider what your definition of a physician advocate is. It can be different for each of us. Some of us may find that calling in just being a brilliant and passionate doctor for our patients, and that is also enough. If you want to take that energy outside of your practice, think about getting involved at any level. It could be even just at your local clinic, changing the way you do things to make systems more equitable. It could be at the community level, meeting with local town leaders to answer their questions and concerns about their community's health. It could be at the state level, the policy level, the regional level. So think about the platform that you want to have and where you want, how far you want your voice to carry. And so there's no wrong answer, but I like to mention that there is a caveat that with that power of your voice comes great responsibility. I think I just quoted Spider-Man. But physicians have historically, because our voices hold such power, the physicians and the sciences have historically, at times, used that power for harm. The Holocaust, Tuskegee experiments, forced sterilization in the United States and in other countries. So recognizing that there have been times where physicians have used their power and their status in society to cause harm, and that there is a balance between activism and agency, and that I would call you to always consider what it means to really be an activist, which is someone who thinks about changing social conditions for the better to help impact the health of individuals in their community. And I hope that in doing that and considering some of those things, you realize that there is some nuance to the role of being a physician advocate, because there isn't like a handbook on how to do it, but to do so responsibly and with the goals and the health of your community first and foremost in your minds and in your hearts. So that's all I have for you guys today. I am always happy to talk to anybody more about Medicare for All, about my work with PNHP and the Illinois Single Payer Coalition. So if anybody wants to reach out to me, you can always email me. The PNHP leadership has my contact information. You can also find me on Twitter, as I mentioned. My handle is MaloofMD. And thank you so much for participating today. And I hope this was a helpful session. Take care.